potty real bad, huh, friend?
All of it was clear.
Oh, good. That's good though.
Good, clear urine.
Good boy. Good boy. I was looking at your vape earlier. I used to have that same mod.
Really? Oh, this is actually the brand new one that just came out a week ago.
Oh.
You had that one probably.
Yep, that's the one I had.
Yep.
I had that one, and it was black. It had like the
Look at the difference.
like the rainbow metal. Oh dang, that's really nice. I haven't had a mod in years. I've been buying the disposals because I'm trying to get off of it. But
Stop it. Those are so bad.
they are, but my mod broke, and I was like, I really don't want to buy any more. So.
You know what? This one right here takes a new coil, and it does not leak. It does not break.
Okay.
That one still leaks and still breaks and has all sorts of issues.
Yeah. I do like the geeks, so I'll have to look more into that.
Oh, also, just to let you know, that's the last one they're making.
Oh, really?
They'll no longer be making coils or mods or juice. They're going to stop.
I hate that.
So you might want to load up.
Yeah.
We just ordered a whole bunch of boxes of our juice, a whole bunch of boxes of coils, and then extra glass.
I'll have to see if they have it down the street over there, because, yeah, I do really like those mods.
Yeah, I got that from the Dollar Tree because I got tired.
All right, are you ready?
Yes.
Okay, so we have everything typed out here for you guys. Just continue to monitor for any symptoms. Keep an eye on that temperature like we had discussed. I went back there, I told her the temperature was 1015, she went. So we're really excited about that. Definitely reach out to your primary, I would say tomorrow, to try to get him in as soon as possible, at least for a surgical consult. They may be able to get him in this week, but again, we're not them, so I can't say, but definitely at least to, sit down with your doctor, discuss your concerns, and, like I said, we'll get all our records over to them as well. That way they have it, and if they have questions, they can reach out to us. We'll be here. If y'all have questions, reach out to us. We'll be here. We ain't going anywhere.
Do you think the limp on his left leg is because of that? Because I checked that leg. I have checked this leg.
I cannot say one way or another, unfortunately.
He acts like it's broken, but it's not.
Yeah. Unfortunately, I cannot say one way or another. That's something that would potentially need more diagnostics performed.
But he's a good actor.
He is a good actor.
Yeah, are you?
But this little flappy thing from where he had his injection, that'll go away, right?
Yeah.
It's okay? It's not any issue to concern about at all?
Over the next 24 hours, his body's going to absorb those fluids, and that'll all go away.
Okay.
All right? Keep an eye out for any lethargy, weakness, trouble breathing. Check those gums like I told you. If the gums start to look more on the pale side, at that point that's concerning. Definitely give us a call. Let me see. Tight swelling of the abdomen is another symptom that she wants you to keep an eye on. If we see any of these things, call us, because that's an emergent situation.
So it's already tight right now. It is very swollen and very tight. Feels like a rock currently right now. Because I felt it when he went by.
Was it that way on presentation as well when you guys got here?
Yes.
Okay. Keep an eye on that. I would say if it gets any worse, since we're sending you guys home, if it's not changed since you guys have gotten here, just make sure it doesn't get any worse.
Do you want me to mark it?
I think that would probably be a good idea.
Okay.
Yeah.
Can I shave?
Yeah.
Can I shave him?
Oh yeah.
Okay.
Yeah. There's nothing wrong with shaving them. Shoot, if I placing IV catheters and stuff, or drawing blood, I would. Back when I was in Florida, I'm not a licensed technician. I was a technician in Florida. When I worked emergency, the patient's coming in, I'm gonna shave them. But, yeah, I wish I could shave more patients to, get blood draws done and things like that. So yeah, absolutely. If that's how you want to keep an eye on it, is by marking it and shaving, marking it to monitor that way, I think that's an excellent idea.
Okay.
So you are more than welcome to do that. Normal vital signs, she went ahead, she put those on here for you as well.
Okay.
So that's number 2 right there. Avoid pressure on the abdomen as best as you can. So scooping like we've been doing, that's great. Try to keep him from jumping on and off furniture. I would say try to keep him from going up and down stairs as best as you can as well. If you're able to carry him up and down stairs, that's fine. Same thing with getting on furniture. He's still allowed on furniture. Just pick him up, put him on there.
Our bed is really high off the ground.
Okay.
And he has 1, 2, 3, 4 steps that he goes up. Once he reaches the 4th step, he's on one of those things that goes at the end of the bed that you can lift up with blankets. Then he's on that. Then from there, there's from here to here. So from here to here, that's about that much of a jump. And he doesn't jump. He just, his legs go up and then he just kind of hops to get on the bed.
I would, for right now, avoid that as best you can.
Just pick him up?
If you're able, you can pick him up, put him on the bed, absolutely.
What about a ramp?
But that's not. You can get a ramp too. Yeah, a ramp would be totally fine. I'm more concerned with him actually the actual motion of that hop to get up to the next step. So a ramp would be fantastic. If you're able to get one of those, that would be awesome to allow him to go up and down as he pleases.
So we need 3 ramps.
We already need ramps.
Like immediately.
Like we already need ramps because
for these guys, for sure, yeah.
Because they got long backs and these ding-dings like to jump.
Yeah, for sure. So ramps, I think, and we're all long dogs, so it's not gonna do anything but help his back too post-op.
Yeah, because they're all,
Mhm.
and he's 20% dash hound.
Yeah.
So, that's where his longness comes from.
Yeah, for sure. So I think ramps would be a great idea, for sure.
Okay.
And then, like I said, schedule, follow up, with your veterinarian. Activity restriction as well, leash walks only. So on the leash to go potty. We're not going out in the yard by ourselves. We can go out in the yard just on a leash to make sure we're not, getting excited like seeing, squirrel, run and chase. We don't want that. So just
He's not gonna be here.
as calm as possible. He's not going to be happy about it. But the last thing that we want is for that mass to rupture before the doctor can get in there and surgically remove that. Because that's what we're monitoring for with those symptoms.
So he's going to need to go potty in the front yard. Yep. He can't go in the back.
Just if we don't have squirrels in the front yard, he's good.
I killed him all.
So yeah, just keep an eye on him. Are you guys going to be home? Is someone going to be home to keep an eye on him?
Somebody's always home.
Okay.
24/7.
Fabulous.
Or I'm retired and we're
I'm
both
yeah.
handicapped. Yeah.
Yeah, then you guys are set. So just keep a really close eye on him. As far as the medications go, I've got both of them here. So the first, I know these are for you.
He's hungry.
He's
I
hungry.
know these aren't fun though. I'm sorry. Do you want to investigate as well?
Yes.
Yes. Yes, with your little dachshund noses. Gosh, I love these guys so much. They're one of my favorite breeds.
You want it?
You can have
I'm
that
pretty sure
one.
my boyfriend would leave me. I have 5 cats and a leopard gecko. He doesn't want any more animals
You
right
have
now.
a
so.
leopard gecko. Those are freaking precious.
His name is Layla. The previous family thought that he was a lady, and he is most certainly not a lady, but he kind of responds to his name, or at least the inflection of my voice when I call him his name. So, but the first one is the antibiotic. I would recommend giving this with food. If for any reason he stops eating, we're seeing GI upset, so vomiting, diarrhea, anything like that, discontinue it, call us. We can potentially switch the antibiotic.
He's been doing lots of burping. Do I count
Burping's
that?
okay. Burping's fine.
Okay.
Yeah. So 2 capsules twice a day for 14 days with food. Make sure to give this to completion. Okay? Just like if you or I were to take antibiotics, we want to make sure we're giving it all the way through.
Do you remember those packets I told you about? The yellow pedigree packets with the food in them? So what I've been doing when I gave him the clindamycin, he eats like a horse. So I just took it and stuck it right in the
That's
gel
perfect.
part, and then I slide it like a Go-Gurt tube into his mouth, and he just
Yeah, that's
swallowed.
perfect.
Okay.
That's awesome. Yeah, you can do that with both of these. And then the second one is the gabapentin. This is for pain management. It's going to be 2 capsules every 8 to 12 hours as needed.
Okay, how am I gonna know if?
So I would definitely go ahead and give him some when we get home.
Okay.
Because he is painful right now. Just keep an eye on him. If in 8 hours he's, starting to seem painful again, you can go ahead and give it. If not, you can just hold off until he starts seeming painful again. But no sooner than every 8 hours.
Okay.
All right. It might cause, like I was saying earlier, mild sedation. That is a normal side effect of this medication. But
Is there any seizure?
No.
Any?
no, this is not a high enough dose. And especially if he's not has he had a seizure in the past?
I don't know if that was a seizure or not when he had that weird head thing.
Okay.
If it was a very mild, very quick
Yeah,
one.
so that did not, was it that head thing that he was doing in here when you and I were in here?
Yes, it
Okay. That did not look like a seizure to me.
was drooling. He
yeah.
wasn't there, and he was like this.
Just keep an eye on him. Gabapentin, it is a very, very safe drug. If he's not had a seizure before, this should not cause a seizure.
Okay.
But definitely keep an eye on him because, you know, he's got a lot going on right now.
Do you hear that?
So
He doesn't usually growl. He's been growling.
You playing good part?
it sounds like him huffing because he's just a little ouchy. Well, I'm sure he's more than a little ouchy, but that definitely sounded more like a little bit of a, you know.
And he's been doing that a lot.
Yeah. So he's probably been painful, pretty.
Do you think he's also maybe feeding off of me?
I mean, our emotions can definitely contribute to how they're feeling as well.
Because I've been really stressed.
Yeah, absolutely. I know one of my cats actually had foreign body surgery like a week and a half ago here. And after I got her home, she was an anxious wreck.
Okay.
So it's definitely possible that he's feeding a little bit off your energy. I mean, it's okay to be nervous. I'm sure he's a little nervous, anxious himself about what all is going on because he has no idea what's going on right now. So, you know, just keep an eye on him. Like I said, we're here all night. If you guys have any questions or concerns after you get home, feel free to call us. We're here, okay?
Mm-hmm.
Do you guys have any other questions for me before you head out?
No.
So stinking cute. Oh my gosh. They are precious. I love Dapple babies so much. If y'all think of anything, let us know.
Thank you.
Absolutely.
Any other questions? No. So I'm gonna keep an eye on his temperature, and then I can take. So, do I have to take his blood pressure manually? Or through the machine?
You don't even necessarily need to take his blood pressure. I wouldn't worry about getting a blood pressure on him unless his temperature starts getting high, or we're seeing those pale gums.
Okay.
So, just keep an eye on, you know, the less invasive, I say, is, you know, I'm talking about monitoring a temperature, but
So keep his activity down.
keep his
basically.
activity down and you know, let him rest, get him a nice comfy bed when you guys get home. Like I said, I think those ramps are an excellent idea.
Okay.
So
And then we're about to go on a trip. He's gonna be in a car for about 12 hours.
okay.
Is that gonna be an issue?
When are you guys going on your trip?
I was thinking next week, but I can possibly postpone it. It's not required.
If he is able to get in for surgery this week, because he's going to need the surgery sooner rather than later.
Okay.
If you're able to get him in for surgery this week,
Postpone.
you're going to need to postpone it. And
Okay,
I hate to say it
I
like
can
that.
postpone it. It's okay.
Yeah, I hate to say it like that, but post-op, you know, especially he's got the really bad dental disease going on, all the infection going on in his mouth, and he's got this mass now. And that's going to be a pretty, it's major abdominal surgery, point blank period. Like I said, it's very safe. Doctors, I've worked with doctors that do mass removals every other day. So it's like if you or I were to get appendicitis and have our appendix removed. That would also be considered a major abdominal surgery. It's very routine, just like a mass removal is. So I wouldn't be too concerned about it, but he is gonna need a lot of your attention when he gets out of the procedure, post-op until recovery, and that's usually a 10 to 14 day period. So I would get him on the books for surgery, and then as long as everything goes well with the surgery, you know, I would plan on taking your trip probably a couple weeks after that. Does that sound okay?
Mm-hmm.
Or just where you go in and stay with the dogs. Eyes on it, all three.
Yeah, I can go by myself.
And I mean, you could also see, I know a lot of the girls here pet sit, but you could also definitely ask at your primary to see if any of the girls there pet sit.
No, we don't want it.
Nobody can
That's
watch that one there.
That's fair.
And nobody can. The only dog in this room that could be babysat
Would be him.
is him.
Okay. I completely understand that, yeah. So,
Obviously, as you see,
mhm.
they're both in her lap, and when she drives, they're both on her shoulder.
Sometimes he tries to do that, so but he's way too. It's 3 years. I cannot do it.
Well, they love you guys a whole lot. And I can tell you guys love them a whole lot too.
Those are kids. Those are babies.
Absolutely. And they're wonderful babies. All right. Well,
Thank
what I'm
you.
gonna do, absolutely. So we are gonna send you with this sheet. This is your copy. I just need to have the ladies up front scan it into your chart.
Okay.
Just because it's got my initials on it to prove that I went over it with you. So I'm gonna have them scan that in. I'm
Thank
gonna
you.
find out which direction I'm sending you guys in to get checked out. Okay.
Thank you.
All right. Absolutely. Give me just one more moment. I'll peek my head back in.
Thanks.